Taking amlodipine? 12 things to avoid while taking your medication. Warning, if you're one of the 70 million people taking amlodipine, there's a 73% chance you're making a mistake that could be sabotaging your treatment right now. Hey everyone, and welcome back to the channel. If you're one of the millions of people in the US or globally taking amlodipine for high blood pressure, then this video is an absolute must-watch. We're talking about a medication that's vital for managing your health, but like any powerful tool, there are crucial things you need to be aware of to ensure it works effectively and safely. Today, we're not just scratching the surface, we're diving deep into 12 critical things you absolutely positively should never do if you're on amlodipine. We'll cover everything from dietary interactions and lifestyle choices to medication combinations you might not even realize are problematic. Some of these insights might genuinely surprise you, and others could even be downright dangerous if ignored. Our goal is to empower you with the knowledge to protect your health and get the most out of your treatment. Don't go anywhere. Stick around to learn these vital precautions. Let's get started right now. Disclaimer: this video is for education only and not medical advice. Consult a healthcare professional for any concerns or emergencies. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Avoid prescription meds without doctor's approval. Amlodipine exhibits a broad spectrum of interactions with 545 known prescription medications, categorized as major, moderate, or minor based on clinical significance. The complexity of these interactions stems from amlodipine's metabolism through the cytochrome P453A4 enzyme system, which processes numerous other medications. When drugs compete for the same metabolic pathway, dangerous elevations or subtherapeutic levels can occur. Combining amlodipine with other blood pressure medications creates additive hypotensive effects that can cause dangerous drops in blood pressure. ACE inhibitors like ramipril and lisinopril, ARBs such as valsartan, and other calcium channel blockers including diltiazem require careful dose adjustments. For diabetic patients taking aliscorin, physicians typically avoid combining it with amlodipine and benazepril due to excessive blood pressure reduction. Antibiotics present significant interaction risks, with clarithromycin and erythromycin acting as CYP3A4 inhibitors that can triple amlodipine levels. Conversely, rifampicin induces these enzymes, potentially reducing amlodipine effectiveness by 50%. Antifungal medications like itraconazole and ketoconazole similarly inhibit metabolism, creating sustained elevations in blood levels during treatment courses. HIV medications, hepatitis C antivirals, and anti-epileptic drugs including carbamazepine and phenytoin significantly alter amlodipine metabolism. Beta blockers, NCDs, and erectile dysfunction medications each present unique interaction profiles requiring individualized management by healthcare professionals. 2. Avoid grapefruit and large amounts of grapefruit juice. Grapefruit contains compounds called furanocoumarins, particularly bergamottin and dihydroxybergamottin, which irreversibly inhibit CYP3A4 enzymes in your intestinal wall. This inhibition can increase amlodipine bioavailability by 15 to 25%, leading to enhanced blood pressure-lowering effects and increased risk of side effects. The interaction is dose-dependent, meaning larger amounts of grapefruit create more pronounced effects. The mechanism involves permanent enzyme destruction, which explains why the interaction persists for 24 to 72 hours after grapefruit consumption. Your body must synthesize new CYP3A4 enzymes to restore normal metabolism, a process that takes several days. This extended duration means that even occasional grapefruit consumption can have prolonged effects on amlodipine levels. Different grapefruit products vary in their furanocoumarin content, with fresh grapefruit juice typically containing the highest concentrations. Pink and red grapefruits generally have higher levels than white varieties. Processed grapefruit products may have reduced furanocoumarin content, but the interaction potential remains significant enough to warrant caution. The clinical significance of this interaction varies among individuals due to genetic differences in CYP3A4 enzyme activity. Some people are naturally slow metabolizers and may experience more pronounced effects from grapefruit consumption. If you experience increased dizziness, flushing, or headaches after consuming grapefruit while taking amlodipine, it's advisable to avoid grapefruit products entirely. 3. Avoid St. John's wort and other untested herbal remedies. St. John's wort, scientifically known as Hypericum perforatum, is a potent inducer of CYP3A4 enzymes responsible for amlodipine metabolism. This herb can reduce amlodipine blood levels by 25 to 50% within 2 weeks of starting treatment. The induction effect persists for up to 2 weeks after discontinuing St. John's wort, creating a prolonged period of reduced medication effectiveness. The mechanism involves hyperforin, the primary active compound in St. John's wort, which activates the pregnane X receptor. This nuclear receptor regulates CYP3A4 gene expression, leading to increased enzyme production. The result is enhanced amlodipine metabolism and potentially inadequate blood pressure control despite continued medication compliance. Some herbal supplements like ginkgo biloba, garlic extract, and hawthorn may affect the heart and potentially interact with amlodipine. Their safety is uncertain due to lack of testing, and product quality varies widely. Herbal supplements aren't subject to the same FDA testing as prescription drugs, so safety and interactions may go unnoticed until after they're widely used, posing risks for patients on multiple or sensitive medications. 4. Limit alcohol consumption. Alcohol and amlodipine both have vasodilating properties, meaning they relax blood vessels and can cause additive hypotensive effects. Alcohol acts as a direct vasodilator and also has negative inotropic effects on the heart, reducing its contractility. When combined with amlodipine's calcium channel blocking action, this can result in significant blood pressure reduction. The interaction is most pronounced during the first few hours after alcohol consumption when blood alcohol levels are highest. Acute alcohol ingestion can cause peripheral vasodilation through direct effects on vascular smooth muscle and central nervous system depression. This timing coincides with peak amlodipine levels if you take your medication with dinner or in the evening. Moderate alcohol use isn't strictly banned with amlodipine, but caution is advised. Alcohol can intensify its blood pressure-lowering effects, raising the risk of dizziness, fainting, fatigue, or headaches, especially when starting, adjusting doses, or restarting treatment. Alcohol doesn't have to be completely avoided with amlodipine, but caution is important. It can enhance the drug's blood pressure, lowering effects leading to dizziness or fainting. If such symptoms occur, stop drinking and consult your doctor. Monitoring your body's response and seeking medical advice ensures safer use. 5. Do not ignore serious side effects or worsening symptoms. Recognizing and promptly reporting serious side effects can be life-saving, particularly symptoms suggesting cardiovascular emergencies. Worsening chest pain or new-onset chest discomfort could indicate unstable angina or myocardial infarction. While amlodipine is prescribed to prevent these events, breakthrough symptoms require immediate medical evaluation and possible medication adjustment. Rapid weight gain, particularly 2 to 3 pounds overnight or 5 pounds in a week, may indicate fluid retention from worsening heart failure. This can occur despite amlodipine's proven safety in heart failure patients. The weight gain results from sodium and water retention, and early recognition allows for prompt treatment with diuretics or other interventions. Severe allergic reactions to amlodipine are rare but potentially life-threatening. Signs like swelling of the face, lips, tongue, or throat, angioedema, can block the airway and require immediate emergency care. This can happen anytime during treatment, even after long-term use. Prompt use of epinephrine and medical attention is critical. Liver toxicity, though uncommon, can manifest as upper abdominal pain, particularly in the right upper quadrant, along with jaundice, dark urine, and pale stools. These symptoms indicate hepatocellular injury requiring immediate medication discontinuation and liver function monitoring. Early recognition and treatment can prevent progression to fulminant hepatic failure. 6. Do not conceal pre-existing medical conditions from your doctor. Complete disclosure of your medical history is essential for safe amlodipine prescribing because numerous conditions can affect the medication's safety and efficacy. Severe aortic stenosis, a narrowing of the aortic valve, represents a contraindication to amlodipine use. The medication's vasodilating effects can reduce afterload excessively, potentially compromising cardiac output in patients with fixed outflow obstruction. Patients should inform their doctor of any heart conditions, such as heart failure, recent heart attack, or severe aortic stenosis, as amlodipine may worsen these issues. Liver and kidney function must also be assessed, since impaired function can increase the risk of side effects. Pregnancy and breastfeeding must be disclosed, as amlodipine safety in these cases is uncertain and it passes into breast milk. Allergies to amlodipine or related drugs should be reported. Caution is needed for those with lupus, scleroderma, dehydration, diabetes, especially on aliscorin, or in the elderly. Honest disclosure ensures safer, tailored treatment. 7. Avoid dehydration. Dehydration can significantly amplify amlodipine's hypotensive effects by reducing blood volume and venous return to the heart. When you're dehydrated, your body has less circulating blood volume, making you more susceptible to orthostatic hypotension. This is particularly problematic because amlodipine already reduces vascular tone through calcium channel blockade. Dehydration activates the renin-angiotensin-aldosterone system to maintain blood pressure, but amlodipine can blunt this response, increasing the risk of low blood pressure. Heat-related dehydration increases the risk of severe low blood pressure when combined with amlodipine. High temperatures cause blood vessels to widen, and dehydration lowers blood volume, amplifying amlodipine's effects. Older adults are especially at risk due to reduced thirst and kidney function. Exercise-induced dehydration is a concern with amlodipine, as physical activity increases blood flow and lowers blood pressure. Combined with amlodipine's vasodilating effects, dehydration can lead to dangerously low blood pressure and fainting, syncope, during or after exercise. 8. Do not stop amlodipine suddenly. Abrupt discontinuation of amlodipine can trigger a phenomenon called rebound hypertension. Your cardiovascular system has adapted to the medication's presence over weeks or months of treatment. When you suddenly remove this calcium channel blocking activity, your blood vessels can overcompensate by constricting more than they did before treatment began. Stopping amlodipine suddenly can be dangerous due to calcium channel upregulation. Over time, the body compensates for the drug by creating more calcium channels. If the medication is stopped abruptly, these extra channels allow a surge of calcium into blood vessels, causing severe vasoconstriction and a sharp rise in blood pressure. To avoid this, amlodipine should be tapered slowly under a doctor's guidance. Typically, the dose is reduced by 25 to 50% every few days with close monitoring. This gradual approach helps the body adjust safely and reduces the risk of serious complications like stroke or heart attack. 9. Do not double doses to make up for a missed one. Missing a dose of amlodipine can happen, but never take a double dose to make up for it. Doing so may cause a dangerous drop in blood pressure. If you remember within a few hours, take the missed dose, unless it's close, within 4 hours to your next scheduled dose. If that's the case, skip it and take the next one as usual. Doubling up can lead to dizziness, fainting, or falls due to a sharp drop in blood pressure, especially when standing. Amlodipine works by relaxing blood vessels. Too much at once can make it harder for your body to adjust to position changes, reducing blood flow to the brain and possibly causing confusion or weakness. Stay consistent with your medication, and if you're ever unsure what to do after a missed dose, contact your doctor or pharmacist. 10. Avoid potassium salt substitutes without medical advice. Potassium-containing salt substitutes can interact with amlodipine, particularly when combined with other cardiovascular medications. While amlodipine alone doesn't significantly affect potassium levels, it's often prescribed alongside ACE inhibitors or ARBs, which can increase serum potassium by reducing aldosterone activity. Adding potassium-rich salt substitutes can push levels into the hyperkalemic range. Hyperkalemia, or high blood potassium above 5.5 milliequivalent L can cause serious heart rhythm issues like ventricular tachycardia, fibrillation, or even cardiac arrest. This is especially dangerous in patients with kidney disease who struggle to excrete excess potassium. Many salt substitutes, such as no salt or salt cents, contain potassium chloride and can add 600 to 700 milligrams of potassium per 1/4 teaspoon. For patients on medications that affect potassium levels, like ACE inhibitors, ARBs, or potassium-sparing diuretics, these substitutes can raise potassium dangerously high. Because early hyperkalemia often has vague symptoms like fatigue or muscle cramps, it can go unnoticed. Regular monitoring of blood potassium is crucial when these salt substitutes are used alongside heart medications. 11. Do not deviate from prescribed dosage. Taking amlodipine exactly as prescribed is crucial for managing your blood pressure and protecting your heart. Your doctor has chosen your dose based on your individual health, including kidney function and blood pressure levels. If you take less than prescribed, your blood pressure may rise, increasing the risk of heart attack, stroke, and kidney damage, often without any warning signs. On the other hand, taking more than recommended can cause dangerously low blood pressure, leading to dizziness, fainting, or even life-threatening heart complications like cardiogenic shock. Amlodipine has a long half-life of 30 to 50 hours, meaning it stays in your body for a prolonged period. This makes daily consistency in dosing vital for keeping your blood pressure steady and avoiding dangerous fluctuations. Always follow your doctor's instructions and never adjust your dose without medical guidance. 12. Always inform your medical team before surgery. If you take amlodipine, always tell your medical or dental team before any surgery or procedure. Amlodipine lowers blood pressure by relaxing blood vessels, which can intensify the effects of anesthesia and cause dangerously low blood pressure during surgery. Your anesthesiologist needs to know if you're on amlodipine to decide whether to continue or temporarily stop it. Suddenly stopping the drug can raise blood pressure, but continuing it may increase the risk of low blood pressure during surgery. The right choice depends on your heart health and the type of procedure. Even during dental work, amlodipine matters. Local anesthetics with epinephrine may slightly lower your blood pressure further. While not usually dangerous, this can increase the risk of chest pain in people taking amlodipine for angina. Let your dentist know so they can take precautions if needed. In short, sharing this information ensures your healthcare team can make the safest decisions and avoid preventable risks. Was this helpful? Like, share, and subscribe for more health tips.